So friends, recently World Health Organization has come up with the Global Tuberculosis Report 2023. So as per the data, tuberculosis is one of the world's major health challenge. So it is in India also, it is biggest health challenge. So in context of this, let's understand some of the important data and the analysis about the tuberculosis disease in the world and in India. As we just understood that the tuberculosis is the world's major and one of the biggest health challenge. So this report provides us a very comprehensive analysis, data, facts with respect to spread of tuberculosis disease in the world. So let's have a quick understanding about this report. So as we understand that this report is published by the WHO as an important healthcare organization, and it provides comprehensive up-to-date assessment of tuberculosis epidemic and also talk about the progress, prevention, diagnosis, treatment of this communicable disease, that is tuberculosis, and in short we say TB. So when it's come to the India, so India is a country, it is also known as the capital of tuberculosis disease in the world. Itself it accounts 27% of tuberculosis disease of the world. So it is a major healthcare challenge for the India, as we understand that public healthcare system is already in a state where it cannot fulfill the need of all the patients. And considering the growth of this tuberculosis, it's really a matter of concern for our public healthcare system. So 27% of the total TB cases in the world alone recorded in India. So that's a very important finding by the Global Tuberculosis Report 2023. So beside this, in 2023, 192 countries and area with more than 99% of the world's population and TB cases reported this data. In India itself, in the year 2020, 220,000 people died due to this tuberculosis, and in the year 2022, more than 3 lakh people died due to this tuberculosis. So this is a very grave and a very concerning image of this tuberculosis disease in India. So it is that need to be addressed with the comprehensive planning and strategy. So as per this global tuberculosis report, just we have discussed, India account alone for 27% of this tuberculosis disease. After this India, we have this Indonesia that account 8%, China 9%, Philippines 6%, Pakistan 6%. So this is how this tuberculosis is being distributed. So friends, let's have an understanding about some of the major findings of Global Tuberculosis Report 2023 in context of India. Tuberculosis is world's second leading cause for death, and when it's come to the multi-drug resistant TB, so it is the evolved form of tuberculosis disease. So when the first stage of drugs stop working against the bacteria, then the person actually come in the stage of MDR, that is multi-drug resistant tuberculosis. So India recorded 1.1 lakh cases of multi-drug resistant tuberculosis in the year 2022. This also highlights the continued challenge of MDR TB as a population health crisis. So when in context of TB cases, fatality ratio in India, it is one of the highest in the world, that is 12%. So out of 100% tuberculosis patient, 12% died in India. This fatality ratio is very high in India because in many cases tuberculosis patients come from the poor socio-economic strata. They lack the enough financial resources to use in addressing of their tuberculosis disease. So as per this estimate, near around 3,42,000 TB related deaths occurred in India in the year 2022. So that's a matter of great concern because health is very important, and when we talk about the demography dividend, health is one of the most important components. So when we have this issue of tuberculosis, and often it is referred that India has become the capital of the tuberculosis disease. So we cannot talk about the dividend, because when the population is not quite healthy, then country can have an issue when it's come to its socio-economic growth and development. 30 high burden TB countries collectively account for 87% of the world TB cases in the year 2022. इसके साथ ही among the top 8 high burden countries in addition to India are Indonesia, China, Philippines, Pakistan, Nigeria, Bangladesh, Democratic Republic of Congo. Countries like India, Indonesia, Philippines accounted for over 60% of tuberculosis disease. So this is a great concern. This increase reverses the decline trend about 2% per year that had been observed for the most of the past 2 decades. So decline in the TB cases is quite slow. India reported a case fatality ratio of 12%, as we have discussed in our previous slides. India also reported 1.1 lakh cases of multi-drug resistant TB. So it's a matter of concern. As TB is a communicable infectious disease, so it requires a very comprehensive planning and support to the patient, so that patient could also recover from the disease. A country should also be able to provide them enough safety and security to other healthy population of a country. As we have just understood that the tuberculosis is one of the major global healthcare challenge, so reduction of tuberculosis disease is a very it's the need of the hour. Toward that, World Health Organization has come up with the end TB strategy by 2027. So, but it has also come up with another initiative, end TB strategy 2025 milestones, and we have to achieve 50% reduction in the tuberculosis, 75% reduction by 2015-2025, and milestone 0 cases in the year 2025. So these are some of the ambitious aim and objective of the WHO eliminating tuberculosis by 2025. And with respect to tuberculosis, country of the world has taken pledge to actually eliminate tuberculosis by the year 2027. As India is the capital of tuberculosis disease, so government of India has taken number of steps toward reducing and eliminating the tuberculosis. So WHO has made the target of by the year 2027 to eliminate the tuberculosis, but the government of India has made it eliminating tuberculosis by the year 2025. So almost 5 years earlier than the global elimination of tuberculosis, that is 2030. So let's understand the initiative taken by the government of India toward eliminating tuberculosis. So first, it has come up with the revised National Tuberculosis Control Program. In short, it is RNTCP. So under this it is a flagship program for the TB control. It was launched in the year 1997, and since it has made significant progress in reducing tuberculosis burden in India. So under this program, it provides free diagnosis and treatment for TB patients, as well as preventive measures to prevent the spread of tuberculosis. So it is a very comprehensive program that has number of area where it is focusing on prevention of the tuberculosis disease from India. Besides this, there is also use of technology. So government of India has come up with the Nikshay portal, and through that portal Nikshay Poshan Yojana is running. Under this, government has provided 2,613 crore over 95 lakh TB patients since its launch in the year 2018. And at the same time, there is also element of the direct benefit transfer. Under this, government provide 500 to the account of TB patient for the fulfilling the needs of nutritious foods for the TB patient. इसके साथ साथ National TB Elimination Program. So this program focuses on eliminating tuberculosis by investing in additional resources that will focus on coming up with a comprehensive health program that will actually take care of the needs of tuberculosis patient and also provide comprehensive strategy for the elimination of the tuberculosis. TB Free Village campaign, it is also a campaign that talk about awareness generation. This is a community-led initiative to eliminate TB from the villages in India, and it was launched in the year 2018. It aims to reach all villages in India by 2025 and will work toward eliminating tuberculosis by the year 2025. Newer patient-centric initiative. This is also another initiative. Under this, like family caregivers model and differentiated care have been introduced. It will ensure further reduction in the mortality and improvement in the treatment and success rates. So this is also a very good initiative when it's come to reducing the tuberculosis cases from India. Under this national strategic plan for the tuberculosis, it will ensure quality diagnosis, treatment supported to the tuberculosis patients. At the same time, it also target for India to eliminate tuberculosis by 2025, that is 5 years before the global target. Global target is to end TB by 2030. 12,000 crore allocated for the next 3 years for the elimination and prevention of the tuberculosis. Free cost of diagnosis treatment for the tuberculosis patient. 500 per person per month for the nutritional support to TB affected patient under the RNTCP. So this is a very comprehensive program and a strategy toward reducing and eliminating the tuberculosis so that the patient could recover and become socially, economically active. So as India is being referred as a tuberculosis capital of the world, so this is not good for the country that has become a world's 5th largest economy, and at the same time we are in the time of reaping the benefit from the demography. So when it's come to the demography dividend, it is important to have a healthy demography so that country could run progressively and could achieve the state of developed India by 2047. Thank you for watching this video, and for such amazing content please subscribe our YouTube channel Selection IS. And friends, किसी भी तरह की प्रिपरेशन से रिलेटेड हेल्प के लिए आप हमारे व्हाट्सएप चैनल 9625350287 के थ्रू आप हमसे जुड़ सकते हैं, और जिसके थ्रू हम आपको पूरी कोशिश करेंगे आपकी प्रिपरेशन मदद करने की. थैंक यू.